BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
This is a stat that I've heard before, but it shocks me every time.
Right?
9 million Canadians are living with diabetes or pre-diabetes. 60% of them will end up with numb feet. This is a common complication from the disease. Health specialist Leah Sarich is here now with how a local doctor and her team have developed specialized footwear that can help.
Is this amazing?
It is amazing.
I was so impressed with this team when I was there. So this is the brainchild of Dr. Brianne Everett. So she's just an incredible woman. She's a plastic and reconstructive surgeon. She saw a lot of patients in her practice with diabetes who had complications with their feet. So they've got numb feet, and this is called peripheral neuropathy. So this is when they have their blood sugars are not under control, they end up with nerve damage on their feet, and basically what happens is they can't feel what's going on their feet. So while all of us are making little micro adjustments as we stand in line for our groceries, these people cannot do that because they don't feel it. She uses a wonderful analogy. It's like when you go to the dentist and you get freezing in your mouth. So they say don't eat while you've got freezing in there because you could chew your cheek or your lip or your tongue. So it's the same thing. These people are having damage to their feet because they just don't have any sensation to say move off that spot. So they end up with these little ulcers in their feet. These ulcers can get infected, then they're in the hospital, and it becomes a huge problem. And then these infections occur over and over and over again. The foot gets severely damaged and then it requires amputation. And so she says we just need to stop this before it even starts. So she came up with this wonderful idea. And it's all about trying to reduce that pressure on the one spot in the foot. And she explains that it's an idea for specialized footwear.
It monitors the bottom of the foot on an ongoing basis, and if there's an area that would be considered at risk for damage, then that area sends an alert to a smartwatch that the patient wears wirelessly, and then they can see in real time where the problem is. So it'll identify, provide an auditory or a vibratory alert, and they can see and modify their behavior so that those complications can be prevented before they actually happen.
So you're basically empowering the patient with information so that they know, okay, I got to move my foot around. So they get these little insoles. You can put them in any sort of runner or walking shoe or diabetic footwear, and you just put them in there, and then it sends this message to the smartphone or their smartwatch that they're wearing. So it's quite incredible, actually. And this is Jody here. You're seeing Jody. She's putting on the shoes right there. Jody has had type 1 diabetes for a decade. Now, she's a nurse, so she's really good at keeping her sugars under control. She's checking multiple times throughout the course of the day. But you know, the thing is with diabetes is that it is a chronic condition. It is a lifelong condition, and no matter how great she is at keeping those sugars in check, eventually she will get complications over time. And she says, you know, it is wonderful, and she loves the idea of being able to prevent problems before they even start.
The fact that people are realizing the epidemic and making a product that can help diabetics be proactive versus always reactive, you know, when things are too late, when you have these ulcers that are developed and it's too late then. If you had a product like this early on for early intervention, possibly all of that could be avoided. So I think all of this type of technology that people are looking at is, you know, is promising for someone like me.
Isn't that marvelous? So basically, if the diabetics are provided with the information they need, they won't wear out these spots on their feet. They're going to be avoiding the medical system altogether. That's the goal, is to avoid it altogether. Currently, patients with diabetes are advised to keep their feet warm, dry, to check them every day, but it's just not enough to prevent these ulcers. So really, there needs to be something else. So really, the goal is to be able to get these shoes in a clinic setting. They're available right now in the US. They're going to be available in Canada in the next 1 to 2 months. So this is very exciting that they'll be available. They'll be available in a clinic setting, but they do cost $700. So the goal is to eventually, they're in clinical trials right now in 2 different universities. If they get the data, then they can show how much money we're actually saving the healthcare system in the long term. Then we can get these patients reimbursed. So it's very exciting. It's a wonderful product.
And she's based here in Calgary.
And she's based here in Calgary.
We love to hear that.
We love to hear these stories.
More information on your blog.
It'll be all on my blog, you bet.
Health specialist Leah Sarich, thank you very much
You're
for
very
that.
welcome.
BreakfastTelevision.ca is the way to connect with Leah. One last check-in with Jill coming up, and one last check on this gorgeous weather.